So the first thing that you should do when you are told to supplement with formula is to reach out to an IBCLC, and hopefully a private practice IBCLC who sees babies from birth all the way through weaning, and not just somebody in the hospital, because their job description is just a little bit different. They are really in those beginning stages of helping people latch their baby, make sure they're transferring in the beginning days, teaching positioning and latching. Before we begin, I want to share something special with all of you expecting parents out there. As an internationally board certified lactation consultant, I've seen firsthand how a little planning can go a long way to helping you achieve your baby feeding goals. That's why I'm offering you my free ebook. It's called Birth Practices to Support Breastfeeding, and it's a workbook. So check out the link in the description below. Hi, and welcome back to Lo's Lactation Lab. My name is Lo. I'm an internationally board certified lactation consultant, a birth doula, and a childbirth educator. Here to talk about how you can go from pregnancy all the way through weaning and feel really good about meeting your breastfeeding goals, or changing your goals and meeting those as new information arises. Today, we're going to talk about what happens when somebody says you need to supplement with formula. This can happen in the hospital. This can happen on day one. This can happen before you leave the hospital because it's been a few days and baby's now losing weight. This can happen at your pediatrician's office. This can happen with well-meaning family members who see you suffering, trying to produce enough milk for your baby. We constantly are being told, why are you stressing about feeding breast milk to your baby when we have another alternative? We have formula now. So we're going to talk about that. We're going to talk about what to do when formula is recommended, and how you can tune into your own inner compass to decide, is that the right choice for your family and your baby, given your unique situation. So before we get into the nitty-gritty of low milk supply and supplementation, I want to start by talking about the emotional impact of supplementation and of low milk supply. So many well-meaning people who suggest switching to formula say things like, my baby was fed formula, or I was fed formula and I'm fine. Like, so many people do it. It's not worth stressing. Your mental health matters most. And these things are true. They're not wrong when they say, I switched to formula and it was the best thing I could do for me, because that was the best thing that they could do for them. Or my baby is fine, or I am fine. These things are all true. There is a lifetime of choices that you are going to be making for your child, and then as your child grows up, that they are going to be making for themselves, that can positively or negatively impact long-term health outcomes. So whether or not they receive formula in the beginning of their life is just the first of many choices. And each time we come to a decision about what is best for our babies, we have to decide what is best in this moment, given my situation, what I can handle, what my finances are, how much support I have to reach my goals, how much time and energy I have to do the things that will help me get to my goals. The fact remains, though, that you are allowed to grieve when something isn't going the way you want it to go. It's okay to feel sad that breastfeeding is painful, or that baby is not transferring enough milk, or that your milk supply is low for whatever reason. It's okay to feel really sad. And it's okay to say to somebody, I will seek your opinion when I want it, but right now I am making the decisions that feel right for me. I've said this before on other episodes, but I think it's worth repeating that when we do something that is really hard, and it doesn't pertain to motherhood or parenting or feeding our babies, we get celebrated for doing that thing. If you go to law school, if you accomplish running a marathon, if you go after some big position and you're able to do it, people celebrate that. But when we work hard to achieve a goal that we have set when it comes to parenting or feeding our babies, we often get shamed for doing the hard thing. And the hard thing might be different for different people. For some of you, when you were told, you know what, you should supplement with formula, you were washed over with a sense of relief. And for others of you, when you got told, you know, it's time to supplement with formula, whether or not that was actually clinically the correct advice, you experience a sense of deep sadness and grief. And that's okay. Just because you're experiencing grief does not mean that you have to experience guilt or shame. Because in the moment when you have to make the choice about what is going to be the best decision right now for your baby, sometimes it's not the one you envisioned or the one that you hoped for initially. Many of my patients come to me not wanting to supplement, and after having an initial consultation and after reviewing all the clinical information, they decide, yeah, you know, for now, this is the right choice for me. And I always like to remind my patients that just because you're making a choice now doesn't mean that has to be the same choice you make in the future, as long as you're getting good clinical information that is going to guide you towards feeding your baby, protecting your supply, and figuring out the root causes of why baby isn't transferring milk or why your milk supply is low. So when you're working with somebody who is able to do that, then you can make a decision now and then work towards meeting your original goal later on down the line. But it's important to remember that in all of these situations, when somebody is recommending to feed formula, it's because they know that the number one goal when it comes to feeding your baby is to feed the baby. So if you are not able to feed the baby with your own milk, then yes, we need to find another way to feed that baby. So let's talk about when that might be appropriate. So there are multiple reasons why you might be asked to supplement with formula. One, baby isn't transferring milk well, and the way that you would know that is because there's not enough pees, there's not enough poops. Maybe baby is incredibly sleepy and they're not waking for feeds. Maybe you're getting close to that 10% weight loss, or maybe you've surpassed that 10% weight loss. So when the baby's born, they take that initial weight, and then all babies are going to lose weight initially in the first 5 to 7 days, but they should then start regaining it. And we're looking to make sure that they don't pass that 10%. Now, there is a caveat here, which is if you have had a medicated birth or you have been induced, you have likely been on IV fluids. And IV fluids, in the same way that you swell up when you've been on IV fluids, you might even gain up to 10 pounds from day 1 of having IV fluids to day 2 of having IV fluids. That's common to see a big weight gain if you're tracking your weight for whatever reason. So just like you swell, the IV fluids do cross the placental barrier and the baby can swell as well. And we're talking about even just a few ounces. That makes a big difference when we're tracking that 10% weight loss. So one of the things that you can do to ensure that you're getting accurate information to be able to make decisions about supplementing is to ask for a 24-hour weight to be recorded into the baby's chart and to use that as the weight that you are tracking the percentage of weight loss. So if you have had IV fluids for longer than a few hours, then that might be something that you want to discuss with your care provider. And that might be something that you discuss prenatally if you are able to. Is it possible to track that weight from the time that baby has hit 24 hours? Because that can make a big difference between whether baby has had a 7 or an 8% weight loss or a 10+% weight loss. And we don't want that birth weight to be inflated if we're really trying to manage lactation care well. So other reasons that formula might be suggested as supplementation are that sometimes when baby has high bilirubin, jaundice, people will suggest formula because the more that a baby eats, the more they are able to clear out that bilirubin from their system. And so often formula is suggested in that time. Painful breastfeeding, raw nipples. Sometimes a parent gets to the point where they say, I cannot latch this baby onto my body one more time. This hurts so badly. And none of the care providers are able to help make positional or latching suggestions that decrease that pain. That might be a reason why formula is suggested. If there are any contraindicated drugs in the system, then that might be a reason why formula is offered. There's a caveat there, though, because most of the time, the providers are giving information based on the drug insert. And drug companies do not want to be sued. And because there are very few studies with breastfeeding dyads, then they just rule out breastfeeding dyads and just say there aren't any studies on this, so it's not safe. So the best place to go for that information is Dr. Hale, who is a doctor, a pharmacologist who researches the safety of medication. His team runs the Infant Risk Center, so you can call there. And then Dr. Hale also has an app. He has one for practitioners, but he also has one for patients. It's called Mommy's Milk. And I do believe you have to pay for that app, but you can go on and you can search information, and it gives a ranking system about the safety of medications, which are often very different from the insert. We see very frequently that providers are telling parents that they have to either wean or pump and dump because of a medication, and often it's actually not contraindicated. And the risk of introducing formula is probably greater than the risk of the medication because the transfer rate is so low in that medication. So that's something to think about. There are some illnesses which are contraindicated for breastfeeding, and this would be something you would want to discuss with your IBCLC or your care provider. So anytime there are lesions on the breast that might transfer, say, herpes to the baby, that's contraindicated. There are some rare genetic disorders which are contraindicated for breastfeeding, and that would come up in the infant screening. That's rare, but it does happen now and then. Actually, my daughter, when she was born, she triggered the newborn screening for Galactosemia, which is a rare genetic disorder which does not allow the body to process any lactose at all, even that in human milk. And so these babies, they have other developmental delays and other difficulties associated with galactosemia, and there are two types of galactosemia, but my daughter triggered it. I had to go off of human milk for a few days until I could get into a geneticist, a specialist, and we were able to do further blood work. And it turns out that she's a carrier of galactosemia, but she does not have galactosemia. So that's one example of a situation where it's a no-brainer. Of course, I needed to switch my daughter to soy formula, which doesn't have lactose, and I continued to pump for about 4 days while we waited for that specialist appointment. I was heartbroken, but then I went in to see a provider who was familiar with these genetic disorders. And this is actually interesting because this is a case where the first provider I called told me it was going to be about 6 weeks till I could get in and do the genetic testing. And I had a newborn. My infant was 2 to 3 days old. She had been fully breastfeeding since the day she was born. We get this newborn screening test back. It comes up positive for galactosemia. My primary care provider called me. She sent me to this specialist. And when he told me, I said, oh my gosh, is there anything we can do? That's a long time for me to be trying to maintain my milk supply. 6 weeks is a long time to wait to see if she has this, because honestly, she's showing none of the signs of her body not being able to process lactose. And I really think that probably something is going on with the genetic screening. And he said to me, do you want your baby to die? And this is a shame tactic that many providers make when they are trying to get you to make the decision they want you to make. They make you feel guilty for not putting your child's best interest as they see it first. Breastfeeding was not just about me. It was about her too. And I knew that having early introduction of formula for a long time would A, make it much harder for me to get her latched after 6 weeks of no latching, B, be very hard to both feed my baby as regularly as a newborn needs to be fed and protect my milk supply. So if we were going to find out in 6 weeks that it was fine and I could go back to feeding, that would be a much harder thing to do. I had a toddler at the time or a preschooler at the time that I was still having to care for. It was going to be hard. And so I found a different specialist. I explained my situation to her. She understood my concern and she said, you know what, if you can suspend breastfeeding, body feeding, giving your milk to your baby until Monday. We were at a Thursday, I think. I can get you in on Monday. And once I get my eyes on her and we do the initial blood work, then maybe we can have a conversation about going back to body feeding. And I felt way more comfortable with that. Of course, I wanted to make sure that my daughter was safe. And I didn't want to wait 6 weeks. So I had to find another provider who understood the importance of body feeding to me and who understood why I would not want to wait 6 weeks. And once the screening got back, that's when we learned that she was a carrier, but that she did not have it herself. And we were told that we could go back to body feeding, as was my original goal. So the other reasons you may be asked to supplement is you have low milk supply. Now, there is a difference between true low milk supply and perceived low milk supply. And part of this is based on cultural expectations. We expect babies to take large amounts. We expect them to sleep for long periods of time. We expect them to be able to sleep when we put them down. We have confused ideas, many of us, about how long it takes for mature milk to come in versus that initial colostrum and what that means for what the baby should be experiencing while we're waiting for that full milk supply to come in. So there is normal newborn behavior, which often gets mistaken for hunger. So cluster feeding, that gets mistaken for, oh, the baby's not transferring milk, not being able to be put down, which we're carry mammals. So our babies expect to be on our bodies at all times. That is normal biologically human behavior, but culturally, we like to be able to put our babies down so they can sleep. Or if they're transferring small amounts or queuing frequently, more frequently than what we imagined they should be, or even what nurses expect them to be doing, then we assume they're not transferring enough. So the way that you know that they're transferring enough is, again, do they have enough pees? Do they have enough poops? Are they looking relaxed? Are you able to hear swallows when they are at the breast? Are they staying awake or actively nursing, even if their eyes are closed, for longer than a few minutes? Or do they just fall asleep right away? Are they hard to wake up to feed? So there's a lot of things in those early newborn days that get confused with low milk supply. And then as time goes on, if babies are in lower percentiles, and I'm not talking lower than 4%, I'm talking like 20% lower, sometimes pediatricians are suggesting we supplement, even though the nature of a growth curve means some people are going to be on the low end and some people are going to be on the high end of that growth curve. But there are some reasons why people have true low supply. I have some episodes on that. In fact, I had an episode with Catherine where she was experiencing low milk supply, and there's 2 episodes with her, and it was hard for her to determine the root cause. But if you work with an internationally board certified lactation consultant, if you work with one of us, we can help you figure out what is the cause. Is it an ineffective latch? Is it insulin resistance? Is it some other underlying medical difficulty that is getting in the way of producing enough milk that we can find working in conjunction with your care provider by getting blood work and then analyzing those results? So sometimes low milk supply can be managed with better lactation management. Other times, you need to work a little harder with your IBCLC to figure out what is it going to be that's going to increase your supply. So the first thing that you should do when you are told to supplement with formula is to reach out to an IBCLC, and hopefully a private practice IBCLC who sees babies from birth all the way through weaning, and not just somebody in the hospital, because their job description is just a little bit different. They are really in those beginning stages of helping people latch their baby, make sure they're transferring in the beginning days, teaching positioning and latching, but often they're not in the weeds as much dealing with patients who have been told to supplement. Or if you've been told to supplement in the hospital and you haven't seen the IBCLC, then go ahead and ask and see if they can help you figure out another way to manage your milk supply and help your baby transfer. The second thing you want to do is supplementation my next best decision, or is pumping and feeding my milk to my baby my next best decision? And depending on your initial goals, on what pumping is like for you, on how you feel about formula in the first place, on how supportive other family members are, this answer is going to be different. But if you're experiencing low milk supply, or if baby isn't transferring milk, we want to help to stimulate the body to produce enough milk. Now, if you start pumping and you are not getting anything, or you're just getting teeny tiny amounts, not enough to feed the baby, which, by the way, in the initial 3 days or so while we're waiting for that mature milk to come in, it's maybe 5 milliliters. It's like a teaspoon. So you do not need a lot in an individual session. But if you aren't able to get a lot of milk out when you begin that pumping, then you should reach out to an IBCLC who is trained in pumping and who understands proper phalange sizing. And I'm going to give a shout out to another clinician, Jeanette Messett-Frem. She owns Babies in Common. She put out the first clinical research study in conjunction with another clinician and a researcher. Many other types of providers are not providing good information. Even the pump suppliers themselves are not providing good information about getting good flange fits. So you need to go over phalange fitting with a good provider, and you can also do a lot of skin to skin. If baby is able to transfer milk, but it's just not enough, you may just need to get skin to skin with baby more and increase the frequency of feedings. Once you've decided, so you've been told you need to supplement with formula, you have a conversation with your partner, with your supporters, with your providers, and you decide, you know what, I'm going to pump and feed that milk to my baby instead. I always recommend you do this with an IBCLC, especially if you want to go back to body feeding at some point. For some people, they are able to pump enough just to provide a little extra supplement to the baby, and they might only need to pump a couple of times a day, and that's enough to get the baby back on track with their weight gain or their milk transfer. For others, they need to pump so much that then it becomes overwhelming to both pump and to body feed. And so at this point, we first feed the baby, then we protect milk supplies. So my recommendation is usually to body feed for fun, for comfort, for nurturing, if pain is not the primary reason why you are needing to supplement, and focus the main nutritional feeds on the pumping and the bottle feeding, but not trying to body feed at every feeding while you're working on your milk supply or getting baby to. There are other things you can do, like use a supplemental nursing system, an SNS, increase your supply, which allows you to feed at the body, but extra milk, whether it's your milk or the formula, is coming through a tube to your body. Now, you also want to make sure that you learn paced bottle feeding techniques and that you are feeding quantities which match what your baby would be getting from your body. So if you are feeding entire 2-ounce bottles on the first 2 days at every feeding, just know that your baby is being primed to expect that amount when they wouldn't be getting that amount for 3 to 4 weeks at any individual nursing session. They're in that first day of life, they get 2 ounces in an entire day of feeding when they body feed. So making sure that you're using paced bottle feeding techniques and that you're feeding quantities which match up with what the baby would be getting if they were body feeding. Now, when it comes to which formula you should feed your baby, that is such a personal decision. And formula companies do a very good job with marketing. They have billions of dollars to spend on marketing to make you feel like the formula you are choosing is most like human milk. And it's just not. We don't even know everything that is in human milk, but the things that we do know, there is just no comparison. Formula is artificial milk. We need it sometimes, just like we need it for little kittens who can't nurse from their parents for whatever reason, but it is not the same. And any provider, even if they are an IBCLC, who is telling you this is the best formula, I would check to make sure they do not have a brand deal or some sort of partnership with that formula company, because there are predatory formula companies who start to pay providers to advertise their brands of formula. We see this a lot on social media, and it actually violates both the World Health Organization Healthy Babies Code and it violates the IBCLC Code of Ethics. So it is totally fine for an IBCLC to go through ingredients of various formulas and help you determine what's right for you. But that's what I would start with. I would look at your options and I would decide what's most important to you. Is it the ingredient list? Is it the source of the ingredients? Is it price? Is it what's easiest to access in your area? So in choosing the initial formula, you have to decide which of those things matters most to you. And then you look at the prices of various formulas. You look at the ingredients list of various formulas. You look at where they source those ingredients. You may look and see, have there been any recalls of the various formulas recently? What are their factory practices? What are the incidents of what is called NEC, or necrotizing enterocolitis? It's a serious gastrointestinal condition primarily affecting premature infants. This is where the lining of the large intestine or the colon becomes inflamed and damaged, and it leads to tissue death. And it's the leading cause of death from gastrointestinal disease in premature infants. And often the use of formula is the cause. And there are actually major lawsuits out right now with some formula companies because they were fed formula without given the choice for human milk, including donated milk. And formula feeding is a risk factor because it can contain bacteria that causes infection and inflammation. So that's something you might want to look at as you're making the decision, and then look and see what are your other options. Is there a friend you could get donated milk from? Is there a milk bank that you might be able to purchase milk from while you are trying to increase your supply? There's a lot of things you could do to figure out how you're going to supplement. So decide on your formula, try it with your baby in proper quantities, preferably working with your IBCLC. And if the baby seems to take it well, that's great. If you notice that baby tends to be a little fussier or upset when they take the formula versus your milk, then you may have to decide, is there something in that formula that is bothering your baby, and try different options as you're working to get your milk supply up. So there is a lot that goes into the decision of whether or not you supplement with formula when that was not your initial plan. And I urge you, if you are being told this, reach out to me. I would love to help you make these decisions. We can book a telehealth consult. You can do it right from my website, and I can help you feel really good about making the next right decision without shame, without guilt, while I cheer you on to help you make your next right goal. You've got this. See you soon.